This is a simplified 3D model of the sphenoid bone. I'm going to introduce you the sphenoid bone from a different perspective that you have maybe never seen before. This visualization is meant to make comprehension of this, sometimes considered the most complex bone in the human body, easier. So here you can see the sphenoid bone from the front view, from the anterior view. And I'm going to rotate it a little bit so you can see it from the lateral view and the posterior view. So let's zoom out. So this is the posterior superior view of the sphenoid bone. And we are going to build this sphenoid bone from the scratch. So you will understand all the different parts and foramen on the sphenoid bone. Okay, let's start from the scratch. So I like to start building a box. Here we have constructed the floor of the sphenoid bone, and you can think of the outline of the sphenoid bone as a box, as an elongated box. So this is meant to be the floor of the box, and this is the anterior wall of the box, as you can see, and this is the lateral wall of the box. So the box we have created so far is without a roof and without the back wall, without the posterior wall. So the sphenoid bone is nothing but a box without the top and back wall. Now I'm gonna add the central body of the sphenoid bone, the corpus. This is the body of the sphenoid bone. So it is in the center within the box, as you can see. Now we are going to remove a T-shaped part of this central body. It is going to have this outline here. We will remove a T-shaped piece from the sagittal view of this central box. As you can see, after removing this T-shaped piece, we have created a more superior and a more inferior hole in this posterior superior quadrant. So what does this posterior superior quadrant refer to? If you divide the sphenoid bone into 4 pieces in the sagittal view, you can see that we have removed this T-shaped piece in the posterior superior part of the sphenoid body. Now let's add a tiny piece of the roof of this elongated box. As you can see, I have added a small piece of the roof of the box. It is just the most anterior part of the roof that is visible, basically. Here you have a better view. Now I'm gonna add a new piece just between this roof and the body of the sphenoid bone. As you can see, the part that I have added is just in between those both structures. It is an elongation of the most medial part of the roof of the sphenoid bone that goes posteriorly. Its lateral part is elongated even further than its medial part. The lateral part goes longer than the medial part. Now let's add a different piece. So I have added a curved plate just lateral to our sphenoid body, and it is in line with this T-shaped chunk that we have removed, and it in turn at its lateral part has an elongation that goes posteriorly, as you can see here. Finally, I'm going to add another piece at the bottom aspect of our box, 2 structures that resemble a box as well, but they do not contain a posterior wall. Also, they do not contain an inferior wall. They are in line with the sphenoid body at its anterior part. As you can see, if this is the anterior part of the sphenoid body, it is in line with it. Its thickness is in line with it as well. Okay, let's add the lateral wall of our main box back to the picture. Now let's name all of these structures that we have added. Okay, I have already told you that this central box with its T-shaped hole in the posterior superior part is the body of the sphenoid bone. So what is this T-shaped hole in the posterior superior part of the body of the sphenoid bone? It is the sella turcica, aka the Turkish saddle. And the vertical part of the letter T, this segment, you want to call this segment the hypophyseal fossa. So the hypophysis or the pituitary gland is lying within this fossa, within this hole. So laterally from this box, we have drawn three walls. So this inferior wall, what I have referred to as the floor of this elongated box, also this anterior wall and this lateral wall. All of these pieces together are referred to as the greater wing of the sphenoid bone. So if there is a greater wing, we need to have a lesser wing as well. The lesser wing is this tiny piece of the roof of our elongated box, this piece here. So the short piece of the roof of our box is the lesser wing of the sphenoid bone. So the lesser wing is in touch with our greater wing at the connection of the roof and the anterior wall of our box. So what is this piece that we have added here? Anterior clinoid process. So if there's an anterior clinoid process, we need to have a posterior clinoid process. So the posterior clinoid process in turn is this lateral edge of our sphenoid body. So we have an anterior clinoid process and a posterior clinoid process. Sometimes we can talk about a middle clinoid process. So what is this curved plate? This piece is the carotid sulcus. Why carotid sulcus? It's because the internal carotid artery will go along this medial segment of the greater wing of the sphenoid body, somewhat in this manner, and ascend up. So basically it will lie in this sulcus here. So the lateral part of this carotid sulcus has an elongation, and this is called the lingula. Lingula in Latin means nothing but the tongue. It resembles a tongue. And this tongue is going to support the internal carotid artery from the lateral aspect. So if the internal carotid artery is coming up this way from posterior to anterior, it is gonna lie in the carotid sulcus. At the same time, the lingula of the sphenoid bone is gonna support it laterally. Our last piece of this 3D model is here. These two boxes that are missing the posterior and inferior wall, they are referred to as the pterygoid process. So our box is standing on these two foots that we refer to as the pterygoid process. And the pterygoid process has two plates basically, the lateral and the medial plate. And this whole gap in between is referred to as the pterygoid fossa. There is a last piece that I want to talk about. It's called the vaginal process. The vaginal process can be seen here, and it is at the topmost part of this medial pterygoid plate. Now let's talk about the foramina of the sphenoid bone, all the holes it contains. I'm going to portray these holes as rods for the beginning so you can see its pathway, and then we're going to convert these rods into real holes, real foramina. I want to start off centrally and go to the periphery. So here, this is gonna display the optic canal, basically where the optic nerve, the second cranial nerve, is gonna go through. So it has a medial to lateral trajectory, as you can see. So next, I want to talk about the superior orbital fissure. The superior orbital fissure is like a box. So it is at the most superior and most medial segment of the anterior wall of our so-called box. Next, we're going to display three foramina. First is called foramen rotundum. So the foramen rotundum is at the inferior-medial part of this anterior wall, and it goes from posterior to anterior. Next, we have the foramen ovale. It is in the center of the inferior wall of our box, and it goes from superior to inferior. Next, we have the foramen spinosum. It is at the posterolateral part of the inferior wall. Just like the foramen ovale, it goes from superior to inferior. And as you can see, we have somewhat like a diagonal alignment of these three foramen. So we have the foramen rotundum, foramen ovale, and foramen spinosum. All of them originate within this sphenoid quote-unquote box, but the foramen rotundum goes anteriorly, whereas foramen ovale and foramen spinosum go inferiorly in their trajectory. Next, we have this foramen lacerum. Foramen lacerum is at the most medial and most posterior part of the floor of the sphenoid bone, as you can see, and it's quite large. And it is called foramen lacerum because the hole resembles a laceration, because in real life it is somewhat edgy. Next, I want to talk about not a true foramen or hole, but a gap between two bones. It is somewhat here. So it goes just like foramen ovale and spinosum from superior to inferior. It is at the posterior margin of the floor of our so-called box. So just to make you understand this fissure better, you need to know that just posteriorly to the sphenoid bone, we have the temporal bone. Specifically, one segment of the temporal bone called the petrous bone. This triangular part of the temporal bone is called the petrous part of the temporal bone. So this fissure in the center is in between the sphenoid bone and the petrous part of the temporal bone. So we call this hole petrosphenoidal fissure. From inferior view, it is not called the petrosphenoid fissure, but inferiorly they call it sphenopetrous fissure. So you basically just change the individual parts of the name. The final foramen I want to talk about are these two. So one is above and the other one is just below the vaginal process, and they are contained in the medial plate of the pterygoid process, and both of them project from posterior to anterior. And what is interesting about these two foramina is they merge into one. So if we remove the pterygoid process, you can see they both start off at the vaginal process superiorly and inferiorly. So this superior canal is called the vomerovaginal canal. You will understand the name when we add up the vomer and the palatine bone in later videos. But for this moment, just remember the superior segment of the canal is called the vomerovaginal canal, and this inferior part of the canal is called the pharyngeal canal, aka palatovaginal canal. And they are both contained in the medial plate of the pterygoid process. Now, let's convert all of these rods into true foramen. So now you can see and appreciate all the foramina. The only foramen that I have not touched is the foramen that originates in the foramen lacerum. The pterygoid or Vidian canal starts off at the anterior part of the foramen lacerum, and it projects from posterior to anterior. And anteriorly, it exits just right here. So basically you can fly through this canal just like this. It has the same trajectory as the foramen rotundum. So let's go through this foramina one more time. So from the anterior view, we have the foramen rotundum, we have the pterygoid or Vidian canal, and here pharyngeal canal. All of these three also go in a diagonal direction when compared with one another. The body of the sphenoid bone has two openings on each side, and these openings open into the sphenoidal sinus. The sphenoidal sinus is the air-filled space within our box. So if you take a sagittal cross-section of the sphenoid bone, you would have an air-filled space within the sphenoid body. And the communication to this air-filled space is through this aperture opening. As you can see here, this is the sphenoid sinus, one of the sinuses of the collection of the paranasal sinuses. Now let's summarize all the structures. So we have our elongated box that has no roof and has no back wall. It just has a lateral wall, an anterior wall, and an inferior wall. And it is standing on 2 foot, the pterygoid processes. These pterygoid processes are also like a box with similar dimensions like our sphenoidal body. But the thickness is just halfway of the sphenoid body. And this box is lacking a posterior and inferior wall, so that you have a medial and a lateral plate, and within these two plates you have the pterygoid fossa. So the roof of this box is very short, it's at the anterior segment only, and it interconnects with the anterior wall of our box. So the box itself, with its anterior, inferior and lateral wall, create the greater wing of the sphenoid bone. And this short superior wall, the roof, is portraying the lesser wing of the sphenoid bone. Centrally within this box, we have a T-shaped hole which portrays the sella turcica. The inferior segment of the sella turcica is the hypophyseal fossa or the pituitary fossa. And laterally between the lesser wing and the body of the sphenoid bone, we have this anterior clinoid process, and here we have the posterior clinoid process, and we may want to talk about a middle clinoid process here as well. Lateral to the sphenoid body, we have the carotid sulcus with its lateral posterior elongation called the lingula of the sphenoid bone. So, summarizing all the holes and foramina, here we have the optic canal, which has a diagonal medial to lateral direction. We have the superior orbital fissure, we have the foramen rotundum, we have the foramen ovale, we have the foramen spinosum, and here we have the petrosphenoid fissure, looking at it from superior direction. Looking at it from inferior direction, it's called the sphenopetrous fissure. At the medial posterior segment of this floor, we have the foramen lacerum. Foramen lacerum in turn contains a hole that goes parallel to the foramen rotundum from posterior to anterior, and it is called the Vidian canal or the pterygoid canal. And looking at the medial plate of the pterygoid process, we have a vaginal process. Superior to the vaginal process, we have the vomerovaginal canal. And inferior to this vaginal process, we have the pharyngeal or palatovaginal canal. Both of them merge into one whole. And looking at the sphenoid bone from anterior view, you can see two apertures entering into the sphenoid sinus that is contained within the sphenoid body. So this is about the sphenoid bone. As you can see, it is a complex bone, but you can make it simple with this 3D model. I want to give you a more detailed look on some of the anatomic structures of the central part of the sphenoid bone, which are highly relevant for neuroanatomists as well as neurosurgeons. Here I have outlined different segments in different colors. So this part is called the planum sphenoidale, plane of the sphenoid bone, or is sometimes referred to as the jugum sphenoidale. So it is somewhat like a plane, as you can see. This segment is called the pre-chiasmatic sulcus. The name is derived from the fact that the chiasma, the crossing of the optic nerve, is sitting just before and on top of the pre-chiasmatic sulcus. Hence the name pre-chiasma. Prefix pre means before. This part is called the hypophyseal fossa that I have already mentioned. This part is called the dorsum sellae, the back of the Turkish saddle, the sella turcica. The dorsum sellae continues inferiorly as the clivus. So all of this would be considered the clivus. Here we have the anterior clinoid process. Here we have the posterior clinoid process. And also we can talk about a middle clinoid process. So the margin between the planum or jugum sphenoidale and the prechiasmatic sulcus is sometimes referred to as the limbus of the sphenoid bone or limbus sphenoidalis. And the margin between the prechiasmatic sulcus and the hypophyseal fossa is called the tuberculum sellae. Sometimes you do have a bridge between the anterior clinoid process and this middle clinoid process. Sometimes you have it, sometimes you don't. And it would look something like this. So basically, we have created a hole now. And you can think of a hole here, you see. And this hole has a name. It is called the carotidoclinoid foramen here. The name is derived from the fact that the carotid artery will go through this hole, and clinoid refers to the fact that this foramen exists only when you have this interclinoidal bridge. As I have told you, the internal carotid artery will go through this hole, so it will go medial to this anterior clinoid process. And we do have two rings that form a collar around the internal carotid artery. This more inferior ring is called the inferior carotid collar or the proximal carotid collar, and the more superior ring is called the superior or distal carotid collar, and they are nothing but pieces from the dura mater. So if you think about the internal carotid artery, it will go through this carotidoclinoidal foramen and emerge up here through this collar. The only structure that is missing is this piece here in blue. It is called the optic strut. So the optic canal laterally has a segment called the optic strut. So the optic strut is the lateral wall of this optic canal. So it outlines the optic nerve laterally. So if you would drill and remove the optic strut, you would decompress the optic nerve laterally. Last two final structures is a midline structure. It goes from top to bottom. It's called the sphenoidal crest, and it has an inferior bulging called the sphenoidal rostrum. That's all about it. We will be talking about all the contents and all the neurovascular structures that go through all these canals and foramina in a different lecture. This is a way of simplifying the complex neuroanatomic structures, and always bear in mind to use this simplified schematic view as an adjunct to your true anatomic studies. Having these concepts in the back of your mind will fasten and facilitate your understanding of these complex structures. I hope you enjoyed the video, and I'm gonna see you next time.